I will be being the timekeeper between me or Henry, or we have a few folks helping with timekeeping. We're going to be very strict about timekeeping. You have 3 minutes to present, and we're going to have 2 minutes of Q&A from judges. We're going to be strict with both presenters and judges, FYI. But we're going to be strict because we have a lot of presentations and we need to go through them in hopefully 2 hours. So let's get started. So this is track E. Hopefully everyone's in the right track. Final presentations. So the hackathon process at a very high level, you guys have just gone through this, but it started with people pitching ideas on Friday night. You guys, we all met on Friday night. It was an exciting time. You started forming teams, you started hacking, you got a lot of feedback from mentors, you iterated on that feedback, and now we're presenting. Judging criteria. You guys have seen this. This has been part of the participant guide since the very beginning now. We're looking at the impact. Judges are going to be looking at the potential impact of the solution, the innovative aspects of the solution, whether or not it can be implemented in the short term and have an impact on the COVID-19 crisis. And obviously, how effective is your presentation in delivery? Like, how effective are you in delivering this message? How clear it is, and how concise you are. So we have 3 wonderful judges. I would love each judge to introduce himself. Paresh.
Hi, everyone. My name is Varesh. I am a longtime Hacking Medicine member and just finished a PhD at MIT. And I'm now a data scientist working on AI and machine learning programs at Berkeley Life Sciences.
Thank you very much. Mark.
Hi, everyone. I'm from the Netherlands. I work as a diplomat on innovation and technology. I'm based in the Boston area. Been working with a lot of entrepreneurs and researchers that want to collaborate in the Boston area, often in life science and health. And we're working with Freddie and the other Hacking Medicine team a lot. So very excited for your pitches.
Awesome. And by the way, I got to say, I love your title, Innovation Attaché. It's so cool. Prashant, please.
Hi, everyone. I'm Prashant Shah. I lead AI initiatives in health and life sciences at Intel.
Awesome. Thank you so much. This is awesome set of judges that we have. Thank you so much for making time to provide not only the questions and deliberations, but also the feedback that is crucial for these teams. So we're going to start it with, well, this is a quick divider slide that I had here. I love actually, I'll mention something that I mentioned on Friday, and I want to mention again. This has been possible with like the help and support of all of the partners that you see represented here. These partners have all been like crucial in defining the problems that you've been working on and providing the resources that you've used throughout the weekend, either being mentorship resources or hackathon resources for you to develop the solutions you worked on. These are partners that are also going to be working with you post-hackathon. So I want to make sure that, first of all, recognize that this has been feasible because of the support we've gotten from partners and from the team, but also acknowledge that this is an opportunity for you post-hackathon to engage with this set of organizations, because all of them are looking forward to seeing what solutions you guys put together and seeing how they could help you implement those solutions so that they have an impact in the midst of this crisis. Without further ado, I'd like to open it up to the Go Corona team. Yes, wait.
Alfonso, hey guys, this is Henry, also on the hack team. Before this starts, just want to answer some confusion. I'm sorry for my little blip in the Slack. We're not communicating out a presentation order for this. Part of the Hacking Medicine and COVID Challenge process is sharing learnings from this event with everyone and seeing each other's presentations. So we'll toggle through presentations and bring those teams up as we go. And for your mentors who want to tune in and see the presentations, we're communicating the Slack links out to those channels.
Thank you so much, Henry. That I was not looking at those questions. Perfect. Guys, so let's get started. I will be keeping time, 3 minutes of presentation and then 2 minutes of Q&A. Go Corona team, please unmute yourself. Do we have the Go Corona team on the line? Great. So we'll continue to the next one. Viral science team. Do we have the viral science team on the line?
Yep, I'm here. This is Morgan Hunter in Cincinnati.
All right, let's get you started.
Awesome. And can I request control or should I click next? What's the best way to do that?
To be fully transparent, I do not know how to, oh, I can give you control.
That would be awesome, but I wasn't sure what you guys want to do.
What's your name?
Morgan Hunter.
Oh, this is exciting. Okay, could you confirm you have control?
Yeah, let's see.
Beautiful. All right, we'll get you started.
Awesome.
We're
Cool.
going to do this then for presentations, guys. All right.
Cool. Awesome. Hi, we are team E25. We are team viral science, and we're super excited to be part of the hackathon. We are looking at things about finding truth in a noisy world. So many of you have probably seen lots of things like, let's see if it's working here. Fake news, hashtag fake news is certainly populating around. Lots of just interesting discussions on social media. And also, I think with all of us working from home, I think that graphic there in the middle really at least resonates with me. I know that when looking at how do we find information out there on the web about COVID-19. On the other side of that, we definitely have quite a bit of data, and there's so much information out there that's really confusing. You see people and hear people eating fish tank cleaner to stay healthy, and also not really knowing that the virus actually dies after a couple of days. So our solution is really looking at how do we take a lot of the chaos out there and apply some order to that. And really our solution here is a portal. But I want to emphasize that this is not just another website. What we're really focused on is aggregating high quality content with a heavy focus on moderation. So what that means is conventional platforms like what you see through YouTube, Twitter, LinkedIn, Facebook, as well as original content coming from scientific journals. And then thinking about using tools like Juicer or Tint to provide some level of moderation to create an interactive web portal to find content that's out there on the web, as well as produce highly entertaining content. So you can think about things like Delta video for safety and that analogy. And we really believe this is really important, when you talk about community spread and really getting that information out there to have that viral spread to reduce community transmission. So our roadmap is nonprofit. We want to get out there. We want to get an impact. We're 501c3, definitely want crowdsource funding, sponsorship. We're hoping that we could have that organization stood up within a week, have a soft launch in another week or so. Actually, the site's already live. Get our full go live MVP up in roughly 2 to 3 weeks, and then consider it through a full roadmap. We also really think that there's possibility for this to kind of look at other health issues moving forward. And there's quite a bit of other content that could be really developed. There's community partners, Disney, things like that, that really could potentially leverage something like this to get their message out there and really help to beat the pandemic. That is our presentation. And we have a really excited team about this. I think we're super stoked to be able to take a look at this opportunity and see where we could go with it. Thank you. Questions?
Thank you so much, Morgan. Now we're going to open it up for 2 minutes of Q&A.
This is Prashant. So, who does the moderation, and how does one decide what is good content versus not so good content?
Yeah.
I'm a lot. Oh, go ahead, Morgan. I can. So basically, we're going to get, hopefully a group of scientists, public health workers, physicians, others in the public sphere, and really just be asking them to help us moderate. So by invitation, some folks may also come to us because they see the website, or, I'm a physician, so I might use it for a patient, say, for example, and then say, hey, you know what, I think I can contribute in the area of how this affects, neurology patients or whatever. And then I might be invited then to be a special moderator who can curate some articles. We have a really great section where we can do a weekly digest, and invite someone to curate that so they can kind of create little snippets of what they think is most relevant in their field.
I do think that some advantages of those web scraper platforms too is that they really do provide a workflow tool for doing some of that moderation as well. But yeah.
Right, I was wondering the same thing, but thanks for that answer. Another question, at some point you mentioned it's going to be, and maybe I misunderstood, but it's going to be both highly factual information and very fun information. So how are you going to choose who's going to see what and when are they going to see it?
Yeah, I think that's a great question. I mean, I think we're really actually mostly focused on the fun content. So really kind of thinking of that Delta safety video and how do we get, really critical information in a digestible form. I think where we mentioned technical information is that we think there's scientific information that could be converted to that kind of fun content as well. And we would be very interested in kind of helping create original content with that too, to help really drive people to our platform.
Thank you, Morgan. That's time, 2 minutes. Thank you so much. Please mute yourself.
Thank you.
And we're gonna go to the next slide. Oh, we included the appendix as well here. So, okay, so we have EXT or previously named Spartan. Please type in or verbally tell me, actually it would be helpful. So let's do something for future teams. I'm gonna ask for, in this case, obviously, please Spartan, tell me who's gonna be presenting so I can give you control. But for future teams, which we're gonna highlight in the coming up section here, so COVID Connect, over the chat window, please text me which individual of your team will be managing slides so I can give them remote control. Great. Okay, so EXT, who do we have for Amanda? Great, oh, that's for COVID Connect. EXT, do we have EXT or Spartan on the line? We don't. Okay, we can potentially come back to you guys later. Okay, COVID Connect. Well, let's see, do we have someone in the chat? Utki, are you part of EXT? Okay, I'll go back then. Please unmute yourself. Okay, we cannot hear you yet. I'll unmute you because I think you're muted.
Can you hear me now?
There's significant echo.
Okay. Give me one.
You need to.
Can you hear me now? Is it without any echo?
Now it's great.
Yes.
I'm going to start
Much
timing you
better.
now.
Hi, we're going to talk about EXT, which is our emergency cross training portal. I cannot change my slides. So the problem that I'm a medical professional, I'm an optometrist myself, actively seeing patients. With home quarantine, I'm stuck at home and I'm not able to be part of the current crisis. That's where I realize that it's not just me, there are many in this same situation. Next, please. So as we can see, that's where we realize this is an iceberg situation where we are only using the tip of the iceberg, which is our frontline doctors, and not being able to use the majority of the category that is available to support this crisis. Next.
You can control it, I believe. Click it.
Yes. So when we took the beachhead market strategy process to look into the healthcare workers data, we realized only a small fraction is being actively used to manage this crisis, while others are also facing unemployment. So the whole idea behind the problem is how can we utilize this by reducing unemployment and helping their overly used medical staff. The solution that we came up with was a cross training at different levels based on different categories of expertise. So this is what we thought, how we can have an EXT workforce. The category 1 is definitely the active frontline responders. The category 2 are the one who have specialities, which can be part of this force. The category 3 are the physicians who can help in triaging the process. And the category 4 are the healthcare support staff, which can help even before the nurses are seeing the patients. The other part is using the online courses, which are already available by WHO, to standardize and help them get certified and quickly be part of this process. Can we go back? I'm not. So this is the solution that we came up with. Whoever has a medical expertise would apply for this process. We will be putting them in different categories based on their qualification. Once they complete the required courses to be in each category, they become part of the joint network force that we require for the hospitals. This network will then be available for hospitals to use as and when needed. And they will be supporting the staff at every different levels that has been mentioned earlier. In return, we can give them a letter of recommendation, recognition, and a small reward to honor their services during this crisis.
And that's 3 minutes now, if you want to complete your final sentence.
So by providing this, we feel to make this even beyond the crisis, we want to make a mandatory cross-training program in a way which is available even after pandemic. That is how we plan to scale this beyond.
Thank you so much, Utki. Let's do 2 minutes of Q&A, judges, please, starting now.
So how will you ensure that the training has actually helped the person acquire the right level of skills in order to be able to do the job more successfully?
So our idea was to use the WHO standard online courses which are already available. And when we tie them up, say if we are using the staff with the nurses to do the pre-screening, the nurses can shadow them for first few patients that they're catering with, and then let them go alone. So shadowing is another part of the process to enroll them and be part of actively using in the field.
Can you give a quick example of of someone right now who is sidelined and what they would go through to get started?
Yes. So being an optometrist, I understand patient psychic, and I really understand what could be the panic situation in this situation. So if I'm talking about category 2, wherein the people when I'm talking about optometrists who understand, who have already been used to making a triage decision, they would be the support system for the nurses to make a better decision on how do we use the patient's responses in better channelizing them in terms of which is emergency and which is not an emergency situation, and help them make better decisions and take away the stress from the nurses.
Probably in the next 20 minutes or so.
Really?
Mm-hmm.
Okay.
Great, Utki. I think we're at time now, but thank you so much for your presentation. I will now go to the next team, COVID Connect. Amanda, I'm going to give you access, remote control. Before we start this presentation, I want to remind everyone to please provide the name of the individual that will be managing the, who I will be providing remote control to, just before. Amanda, let's wait a second.
Oh, sorry.
That's okay. Just before your presentation. So don't send the names of the individuals related to your team until you see that your team is coming up, because if not, it's gonna get lost in the chat. So for the link COVID-19 Dream Team, please send that over the chat and I'll give you remote control access. And Amanda, you're good to go now.
Okay. Oops, sorry, just making sure I have it right. All right, thank you. We're COVID Connect, and we're connecting COVID patients and their loved ones to reduce feelings of isolation. My best friend's dad is in the hospital with COVID. He's older, he doesn't have a smartphone. When he first went in, he didn't realize he would end up being hospitalized, and he forgot his phone charger. His family had no way to get in touch with him for over a day. He was anxious and alone. They were worried and helpless. To address this problem, we've interviewed medical doctors working in COVID wards. Nurses and doctors are having to take care of patients' physical and social needs as proxy for families. There are strict no visitor policies. strict hygiene policies that don't allow anything new in or out of patient rooms. Patients are feeling anxious and their mental health suffers. Many patients are not interested in eating. Our solution, COVID Connect, a web-based platform connecting patients and their social networks when they need it most. It's high impact, reaching many isolated patients, and high feasibility, as it works with existing hospital infrastructure and COVID policies. Our COVID web app allows families to send encouraging notes to their loved ones and connect with other families that are affected. Our innovative process starts when a family member uses COVID to send their message. The message is printed at the hospital using existing resources in the Dietary and Food Services Department. The message is affixed to the patient's meal and delivered by a staff member who was already approved to have patient contact. Our concept has been validated by a team of experts from the medical and mental health industry. They think it's a great way to improve mental health, help vulnerable populations, and it's feasible. It works with current COVID hospital policies. Just yesterday, the White House acknowledged the mental health burden health providers are carrying, and COVID alleviates that too. This is an ultra low cost solution building on existing resources in hospitals. The app is likely to be supported by hospitals as they want to reduce burden on their doctors, and we have opportunities for paid advertising and government support. We're ready for the next steps. First, we're going to roll out our rapid feasibility trial at NYU Langone Hospital in New York City, where we have connections and there's a high burden. We're going to work out the process before rolling it out to 5 more New York-based hospitals, and once perfected, we're pushing it out globally. We have vision and plans for scaling this solution beyond the pandemic using smart technology to reduce loneliness in hospitals long term. We have a great team capable of delivering projects on a short timeline. We have a diverse skill set, and we're ready for the next steps. Are you ready to connect with us on COVID Connect? We're providing a highly impactful and feasible solution to improve the mental health and well-being of vulnerable COVID patients. We can also reduce the mental stress and work burden of healthcare workers, freeing them up to serve others and save lives. Thank you.
Great timing. Okay, that was perfect. All right, so we're going to do 2 minutes. Great presentation. 2 minutes. I'm going to remove the remote control, and 2 minutes from judges.
Hello, it's Anatoly from COVID Connect here. How can you hear me?
Yes, we can.
Yeah, I'll jump into the Q&A section.
Okay.
Yeah, do you have a view of what percentage of patients is not connected via a smart device, but that actually would need analog way of communicating with loved ones?
So we don't have access to that data, but we anticipate on targeting the low-income population, the elderly, and those who are not very tech-savvy, and the people with some mental issues like depression who don't want to connect with their families. So it is a significant amount of people that are affected. Moreover, some people forget their phones or chargers, so it could be a 1 or 2 or 3 day issue, even for those who have technology but just forgot it.
So you mentioned that it works with the existing hospital infrastructure, but how much of a technical challenge is it to get connected in the first place? And how long does it take to get started?
So we anticipate it to be a smooth process. We'll validate a few admin staff people in a specific hospital, give them accesses, and that's it. It would be connecting through a phone, a tablet, or a computer. They would be receiving messages, and in 1 or 2 clicks, they'll be able to print it on a regular printer, and then they'll fold it and tape it to the meal.
Is there a 2-way communication possible, or is this a 1-way communication?
So as for now, this exact solution is 1-way. We anticipate to have a 2-way when we would be exploring smart tech like smart speakers, maybe Amazon Echo, Google Mini Home, you would know, all of those smart sensors and stuff to allow both ways.
Thank you so much, judges, and thank you for the answers there. Those are the 2 minutes. COVID Connect, great presentation. Love it.
Thank you so much.
We're good. We're going to go into the next. Oh, we have extra slide here. Okay. Link COVID-19 team. Joanna Bass. Great. I'm going to give you control.
Great. Thank you.
and take it over.
Cool. Sorry, I'm just still trying to
You
find
just
where
gotta
the
click on
intros
it.
are.
There
Oh,
you go.
perfect. Okay, great. This is link. Unemployment rates, hiring, working from home. The pandemic is changing everything about the state of work. Americans have filed an unprecedented 10 million jobless claims in the month of March. The industries with the biggest hiring declines include travel, fitness, entertainment, and education. Unemployment is one of the many unintended consequences of social distancing measures. This is the problem we're focusing on. Take this scenario as an example of how the way we're working has changed. Sarah used to teach Spanish classes and is now unemployed after the closure of her language school. I don't know how long the COVID-19 crisis will last, and I'm stressed about my financial security. Emily is now fully working from home and her children are out of school. Communicating remotely with my team is already challenging enough, but now I need to keep my family healthy as well. We're tackling this with Link, a marketplace for one-on-one virtual experiences, matching recently unemployed individuals with increased demand during times of physical distance. Emily uses Link to find tutors to keep her children engaged during times of quarantine. Emily finds Sarah's Spanish classes and purchases a few one-on-one sessions for her children. Sarah dials the kids using Skype daily and tailors the Spanish lessons to their needs. As her children are occupied, Emily can focus on her work. Later in the day, Emily uses Link.
Oh, sorry.
Later in the day, Emily uses the Link platform to connect with George, a personal trainer, to make sure that she's staying healthy. These virtual experiences will be in real time and personalized to customer needs. Experiences will happen over existing tools such as Skype and WhatsApp, so that's not something the platform will have to develop. As customers use the experiences, they will provide feedback and create additional demand. These experiences offer will scale to address the growing set of mental and physical health needs. Unlike our competitors, Link offers a personalized virtual experiences for customers, paying suppliers per session. Differentiation is also created through our customer and supplier retention features, such as a referral scheme where experienced providers can benefit from recommending their colleagues, and a community where customers can request content. In the initial stage of Link, we will be focusing on a specific service group and unemployed skill set, for example, tutoring, personal training, or cooking classes for work from home parents. In later stages, we'll be addressing other virtual services to fulfill additional customer demand, especially in the travel space, and looking at partnerships with businesses to have a larger supply base of experienced providers. Beyond COVID-19, for suppliers, Link will continue to be a source of alternative income, and for customers, Link will offer a wide range of personalized services offered conveniently through digital channels. Thank you.
Perfect timing. Thank you so much again. Now I'm gonna remove remote control, and I'm gonna allow for judges to ask 2 minutes of questions.
The great presentation.
Oh, just also from the Link team. I just wanted to make sure we could hear.
Yeah, thanks, Derek. So fantastic presentation and a great problem and solution. How will you vet who's really experienced and who's not? And how will you sort of filter out people who are truly skilled versus not?
Yeah, that's a really good question, and it's going to be especially critical in the early stages of the platform. So we're looking at sources where individuals might have the past work experience, so looking to their LinkedIn and ensuring that at least initially we're focusing on an already skilled supplier base. Another avenue is partnering with large companies that have recently faced a lot of unemployment and capturing all of their unemployed workers and using that as a way to vet them. In later stages, the customers themselves will provide feedback on the quality of experience provided.
Yes, we also expect in the initial stages to form some expert partnerships to at least get the authoritative vetting process started.
You may want to consider having some sort of a quiz or some sort of an exam or a test or some sort of an assessment as a part of the platform so that you can also have scores on there. But it's a fantastic idea. I really love it.
Oh, thanks.
Thank you.
Thank you so much, guys. We're going to continue to our next presentation, live stream, and then we have protons. So Kristen, let me give you remote access. You're good to go.
Okay, thank you. So hi, my name is Kristen from the E12 team, and I'm going to talk to you about our problem where we're trying to tackle feelings of social isolation in a physically distanced world.
You want to, yeah, there you go.
Not working? Oh, there we go. Can you go back? I'll just talk about it. So right now we have people who are physically isolated in their homes because of COVID, and that's leading to feelings of loneliness and decreased mental well-being. And people are trying to find an easy way of connecting with each other while they're physically apart. And we see this now in the advent of the increase in live streams. You have huge increases in viewership over multiple platforms, including Facebook, Instagram, Twitch, and YouTube. So why is live important? Because it helps you to feel alive. When there's a possibility of anything going wrong, the people who are experiencing it feel this connection, this empathy for the people who are performing. So you have people on Instagram looking for more music. You have people on Twitter looking for more watch parties. You have people on Facebook trying to connect with each other. So we have the live. Now we need to figure out the where, the what, and the when. And we do this through our platform called Livestream Now. How do we physically distance but socially together? On Livestream Now, we have an aggregate of links to live streams that are happening right now. It's all API driven over multiple platforms. And we have a function where you can chat with the people about each event. You can click on hashtags or keywords so you can go to related content or just go to the event itself that you want to see. Now, there are other alternatives to what we're proposing, but we believe that we are better. Where you have Eventbrite, it's for ticketing, but not community. Reddit, you have the community, but not the specific live events. You have lists of articles with events that may have already happened. There's no specific filter. It's just not as easy. Whereas on Livestream Now, you have high quality live streams, easy to find content. You're not worried about waiting for your friends. You don't have to sift through articles. You don't have the bias of a Reddit or Eventbrite. It's just about finding that live experience you crave. And how is this viable? This market is new, it's huge, it's profitable. Literally billions of viewers, millions of live streams every day, possible opportunities for millions of people to visit this site every day, even post-COVID. And if you don't believe me, just yesterday in Brazil, they had their highest ever one-day single live viewing with 3 million Brazilians tuning in to just one YouTube video. So the idea is that we are physically distant, but we can be socially together, and Livestream Now can help you do that.
This is awesome. Thank you so much, Kristen. I'm going to remove remote control from you. And I'm going to open it up for judges to ask 2 minutes of questions.
Thanks a lot. That was really great. And this slide is actually waiting for this slide because I was wondering who you guys are. Yeah, so I can see this really happening, but I wonder who's going to curate the content. So there's going to be a ton of events, right? If you put it all together. So who's going to be moderating it?
So the curated events actually will come from data from the platforms themselves, like Facebook, YouTube, Instagram, that have viewers and information about how big the event is. It'll be automatically categorized.
And the categorization is also in part based on how many are attending. And then down the road, we're hoping to integrate voting and other ways of like how to recommend content.
And since we're trying to bring brands on to sponsor those events, the idea is that we have a list of the events that are going live throughout the day, and the brands that are sponsoring this, they can create their own list. They're going to be the main list for the day.
So then are you also including live streams from individuals? And is there a way to respect the privacy settings that individuals would have on those live streams?
We don't anticipate live streaming through the program, so that Facebook, Google, YouTube allow us to direct traffic to their websites. However, they'll find the live stream through our website. So the privacy settings will be what they post on Facebook, YouTube, or any other website.
Well, that's what you have like 4 seconds. So I'm going to stop the Q&A there. Thank you so much. Guys, I mean, I talked to you guys throughout the hackathon. I've seen this go from the very beginning on Friday when you guys pitched the idea to now, and super proud to see what has been put together in literally less than 48 hours. So congrats. And let's move on to the next team. Woo. Protons. So in Protons, I will provide access to Paige. Yes. Paige, I'll give you access in just a second. If you could unmute, that'd be great.
Yep.
I'm gonna.
Can you hear me?
We can hear you.
Beautiful.
Go get it.
Okay. All right. So you're doing the sharing. Okay. All right. So we are Team Proton, and we are focusing on positively impacting senior citizens during this time of quarantine. So if you could go to the next slide.
You should be able to flip them if you click.
Oh, really?
Yeah.
Okay. Oh, this is so weird.
You want to go back?
Yeah. Sorry.
There you go.
Okay. So we are focusing on loneliness in senior citizens, specifically living in assisted living areas and communities. And this is a unique problem because it's a solution that has the potential to have a wide-scale impact that extends far beyond COVID-19. Why is that? That's because loneliness is not a new crisis. It's something that's been around forever, and it's something that's being amplified by COVID. But the one thing that we do know is that a sense of community really does drive longevity in patients. So what we wanted to do how do you bring community to patients when they're forced into isolation? Well, we wanted to leverage technology to do that. So we were thinking about the demographic, and we wanted a simple, easy to use tool. So we really did focus on Alexa, which is a voice skill. And so the voice skill that we wanted to really focus on does two things. One, it would be able to connect you with your community. So events that are being canceled, where people really once felt like they had a sense of community during book clubs, during live music events, you could now bring that virtual and bring it to Alexa and join these live streaming events together. But also you could connect with someone resident to resident. And so what we wanted to do was sort of bring that to life by showing you what it might be like to challenge someone to play trivia with you, one of your neighbors. So if you go to the next slide, and we'll simulate that. Can you hear it?
I can, but I don't think I set up the Zoom so that it would be shared with everyone.
Okay. All right. Well, I can talk it through then. So essentially, Lori says, "Hey Alexa, I want to play a game with Nancy." And Alexa goes through the gamut of saying, yes, here's your first question. Would you like to ask Nancy the same question? She says, no, ask her a different question. Nancy gets pinged by Alexa. So she sees a light go off, and she sees Alexa, a door knocking sound to indicate that someone's trying to reach you. So she says, Alexa, who's knocking on my door? And she says, Nancy, Lori would like to play a game with you. So to wrap this up, because I heard the bell, you get the sense of community here by being able to engage with people. Why would businesses want to adopt this? Well, assisted living facilities would improve their quality of treatment and care, in the way families and loved ones look to place their patients and their loved ones, because they want to make sure they're getting the best care possible. So having innovative ways to get them to engage in the community, it makes them feel current, And we'd want to do this in a phased approach. Of course, we can talk more about that in QA.
Sounds
And
good.
yeah, we do have some thoughts on the tech that it would take to implement this.
Awesome, Paige. Thank you so much. I'm going to remove control access and allow for judges to ask questions.
So how would you ensure privacy and, if somebody does not want to participate or doesn't want to be bothered, how would you, have you considered how you would account for that in your solution?
Hello, that's a nice question. This is Krish. Can you, hey Alfonso, can you move to the appendix slide? The next slide. See, this is the workflow of what we are going to implement. Basically, as far as the privacy is concerned, we'll be taking all of these in a local server within the resident, so that only the people who are there in the assisted living home, those are connected, and obviously people can find that who are my friends and who are not, and obviously they can say yes or no to the request of people.
Okay, another question. Where do you get the content? So who creates the trivia games, the etc., the movie nights, the happy hours?
Yeah, so I was going to say, I think so what's nice about this is that we're leveraging technology that already exists, but we're just expanding on the capabilities. So creating trivia on Alexa as a skill isn't novel by any means. So I think that would be one of the more fairly easy things to implement as far as building that out. And then for community events, you don't have to participate, but you certainly can if you like.
I was muted. Thank you so much, team. And thank you so much, judges. You guys have done an awesome job, by the way. I remember hearing about this yesterday as well. So love the product. We're going to move to our next presentation, Community First. And I believe I will provide access to Carrie.
Yes.
Right. Okay. All right.
Wait, let me just confirm.
So you can just click the slide to move forward.
Let me just confirm that that's true.
There you go.
Great. So hi, we're Community First, and we're focused on empowering our communities in this time of social distancing. And we're really fortunate to have such a great diverse team that can help address this problem, in addition to 2 mentors who have helped us understand the roadblocks that we'll see in implementation. And the problem we're trying to address here is that in this time of social distancing, we've been able to see our communities come together online, but some of the most vulnerable populations are left out of this because they are not connected to the internet and are now completely cut off from resources and support systems. So what we are trying to do is to utilize existing communities, places like churches and community centers, to connect volunteers to people who need help the most through a task-based system that does not require recipients of care to have access to the internet. In our solution, we see 3 main users. First, we see recipients, people like Carl, who live alone and because of conditions can't take care of basic tasks in this time of pandemic and don't have access to the internet, so they can't ask on Facebook like a lot of us. Then we have people like Caitlin, who want to help their communities but don't quite know how. And finally, we have our key persona here, our organizers, like Miss Maddie Marshall, people who are plugged into communities and know where these people like Carl are and how to reach out to them, but because of social distancing, are overwhelmed and don't always have the resources and time to get them the things they need. So let's see how Community First can help out someone like Carl. Let's say Miss Maddie reaches out to Carl and discovers he needs groceries. Maddie can input this task into our platform, which is then assigned to someone like Caitlin, who can call Carl, confirm what he needs, tell him when the groceries are going to be delivered, and then safely deliver the groceries. The magic of this is that from Carl's perspective, all of this is happening on the phone, which he has access to, but we have a platform in the background that's helping Maddie and Caitlin perform these tasks. Miss Maddie is able to keep track of all of the tasks in her community and know who is getting the care they need to make sure no one slips through the cracks. Caitlin then is able to see all of her tasks and when they're due, in addition to being able to keep a weekly calling list of people who need just
some social interaction when they don't have access to the internet. Over on the right, we can see what a task fee would look like for Caitlin. For example, getting groceries for Carl. What we're trying to do is only give the information our volunteers need to complete the task to make sure that we're protecting these vulnerable populations as much as possible. Moving forward, we would want to partner with sponsors to develop a minimal viable product. This is a web application, so we would want to use cloud resources in addition to ones that would help us protect this information on vulnerable populations. Also, the secret sauce in this project is our communities, these churches, these community centers, and we've had the good fortune of being able to reach out to them and validate that this tool would be something they would be excited to use, including the real life Miss Maddie Marshall. Additionally, this can be extended into inventory management to help match people to resources. In summary, we are trying to help connect people who aren't on the internet to the care they need using the technology that they have available to them and the communities that they know and trust. So at this point, we'd be happy to take questions. We do have backup slides, so if we can keep control just to navigate through those, that'd be awesome.
Okay, I'll allow for control. Judges, please.
So a key question for me would be, how would you ensure the safety of the person who's requesting services or wants a connection? The COVID-19 can spread pretty quickly. So how would you ensure that the person actually delivering the groceries does not have COVID? And then even in general safety, safety concerns around, that you're having the right person actually come and interact with this person who's low tech. So any safety considerations that you've thought about? Yeah.
Definitely, we've considered that, and it's especially challenging given the low testing environment at present. One thing we discussed is having a volunteer affirm each time before they accept the task that they haven't exhibited any symptoms as just a personal confirmation. But unfortunately, it is challenging in a world where there is not as much testing. Also, we would allow community organizers to refer their volunteers, and volunteers could only be referred by organizers or volunteers to make sure that we mostly have people who have good intentions on the platform.
So it seems like these community organizations are definitely key here. So how do you reach them and how do you get them on board?
Several people on our team have great connections already within their communities. For example, Eric works heavily in Charlotte, and both of our mentors work heavily in their communities, so that's a great place to start. Also, many of these organizations kind of have a national overhead, so these would be the people we reached out to first. For example, the National YMCA or the national organizations for many churches.
Great, I think that's all the time we have. Thank you so much, Carrie and team, for the presentation.
Thank you.
We're now, you could go back on, thank you, went back on mute, awesome. So now we're gonna go to the next. By the way, I hope you guys engaged with the AWS team. We had a team of AWS that really wanted to help. So now we have Shift, and coming up, we have the team called Be Happy, okay? So in Shift, I believe, Eric, I'm gonna give you access.
Brilliant.
Unmute, there you go.
Am I audible?
You are audible.
Excellent. So I am Eric Wilson, and we are Shift. COVID-19 has drastically altered the employment landscape. To understand how, consider two low-income workers. First, a chef at a local dine-in restaurant who lost her job when her employer had to close. She's one of the 10 million people who filed for unemployment in the past few weeks, and she needs $800 to make rent this month. Next, consider a prep cook whose chain restaurant employer remains open. She's among the 36 million people who work in essential functions, and she makes $15 per hour. She just tested positive, and now she needs to stay at home for 2 weeks. But if she does, she'll need a $200 payday loan to cover her bills. And if she takes too much time off, she may lose her job entirely. Fortunately, in this universe, the healthy chef, the sick chef, and the employer all use the Shift app. The sick chef, the seller in this environment, logs onto a screen like this one. Note, the data here on the screen are pulled directly from the employer's payroll and shift management systems, so it's easy for her to select which shifts she wants to sell and how much to charge as a fee. In this case, she opts to receive $3 per hour which will earn her about $240 over her quarantine period. That's enough to pay the bills. The unemployed chef, the buyer in this case, logs on and sees a screen like this one. The options here are tailored to skills and experience she has provided on her profile. She sees that the shifts that the seller is offering will earn her $960 total, enough to pay her rent. The buyer selects the seller's offer, and Shift applies an algorithm to rank her against other prospective replacement workers in terms of skill, proximity, need, and several other factors. Managers at the employer then use this ranking, along with industry standard verification tools, to select their favorite candidate. The sick chef quarantines appropriately and pays her bills. The healthy chef goes to work and pays her rent. The employer minimizes the risk of infected food and doesn't incur the cost of losing an employee. Now, this universe doesn't exist yet, but there's an enormous market opportunity. There are 13 million food prep employees in the United States. This industry has a major turnover problem. Over 50% of frontline workers turn over annually at a cost of $3,000 per employee turnover. If you do the math, this comes out to about $10 billion in losses nationally under some relatively conservative assumptions. We plan to establish a beachhead in food prep in Boston. There are about 230,000 people working in this space, and it's also one of the most affected by COVID-19. We eventually plan to expand to additional industries over time, offering our solution as a benefit that employers can provide to their employees. Finally, we have the team to make this work. We have deep expertise in entrepreneurship, fintech, big tech, major corporates, immunology, and venture philanthropy. We have expertise in serving low-income workers, protecting data privacy, building matching markets, and applying machine learning and deep learning across a wide variety of sectors. We have strong local networks in Boston, and we have these connections in venture philanthropy and other sources of capital from across all of these sectors as well. Thank you very much, and I look forward to your questions.
Thank you so much, Eric. I hope you guys know people at Toast as well, honestly, especially here in Boston. Let me allow judges to ask questions for 2 minutes, and I'll take back remote control.
Good you mentioned Toast, Eric. Yeah, I was actually wondering about that launch. You said we're going to launch in Boston, but how are you going to reach that big target population? And do you have any launching customers in mind that would actually be your first suppliers?
Yeah, so in terms of distribution channels, we think there's an opportunity to collaborate with local government. So the Massachusetts Department of Unemployment Assistance would be one area to consider. Another area are indeed, local food and beverage outlets, places that have remained open and need workers, or alternatively need to offer this service to their existing workers who want to stay home because they're becoming sick.
So how would you certify somebody is skilled enough to be able to do the job that needs to get done?
Sure. So when I mentioned earlier on the slides, industry standard verification tools, a number of those tools exist to, view somebody's employment history, determine whether they have the experience that they say they have. So if they say they worked at, a TGI Fridays or in the restaurant industry for 5 years as a line chef, you could actually go and determine whether that or not that was the case. As the app developed, you can imagine a rating system similar to Uber or Lyft, where previous employers who have employed this person in a temporary way or even on a permanent basis would be able to recommend them according to the services that they rendered.
We have 20 seconds for one more question if you guys want to ask.
One quick question. You brought up the worker who is sick. Can you describe how this actually affects that worker besides allowing them to stay home? How do they continue to receive income?
Yeah, so on another slide that we have in the appendix, if you can go to the next quickly, and just click through all the animation. So once folks move through the app flow, the seller actually, or the employer will actually pay the salary that they would have paid to the seller, the employee who was sick, to the Shift app. The Shift app then breaks off a commission from that and provides it directly to the sick employee. That could be some percentage of their original salary or a rate set by the seller themselves. And then the rest of the salary goes to the buyer. That gives them the liquidity that they need to remain home, gives the employer the ability to pay them a little bit at least to remain home. And when the alternative is either laying them off entirely or not paying them at all, that's a major boon, particularly for low-income workers.
Sounds good. Eric, I'll have to cut you there for sake of time. Love the idea. General item, my only thing when I see this three-way marketplace, I'd only say one thing: try to see if you can figure out how to make it work with 2 players initially and test it out. So every new player in a marketplace increases complexity significantly. Now we're gonna move to the next presentation, Be Happy, and the one following that one is gonna be Distance Domestic Violence. In Be Happy, I believe I'm giving access to Ethan. So Ethan, I'm gonna give you access in just a second. Great, should have access now.
Awesome, cool. All right, cool, start right now. All right, during this time of crisis, it was a simple call to action. Be happy. Unfortunately, this is not possible for a large population of people, namely our elderly citizens. In fact, 25 to 30% of elderly citizens are living alone right now, and as much as 33 to 43% of the elderly were reporting signs of loneliness before the onset of the coronavirus crisis. This is particularly concerning. We ask that you put yourself in the mind of Charlie here, a 71-year-old man who would like to discover mental health resources for himself, but does not know how or where to go for this. As it turns out, there are a wide array of already existing resources that have amazing track records in providing mental health resources. However, unfortunately, a senior such as Charlie likely is not aware of all these resources, and if he is, he might not know what of these is best for him. We propose an innovative system which is characterized by a 5-stage solution. Initially, we will perform an outreach stage, partnering with nonprofit organizations and healthcare providers to make our platform well-known and accessible by senior citizens. Through a clinically approved depression screening quiz and interest survey, we can match users with organizations that are appropriate for them. Next, through our system, we can determine appropriate patient resources based upon the quiz that they have taken and match them up. Next, we will follow up with the users of the application to determine what worked well for them and provide continual data back into the system to make better predictions for future users. And of course, following healthcare guidelines throughout the whole process. Another very important characterization of this app is the ease of accessibility for anybody of any technological backgrounds. We have some simple mock-ups here which show the discrete options and difficulty in messing it up so that anybody can access these. Additionally, we propose a wide range of ways to access our platform, such as desktop, mobile, Amazon Alexa or Google Home here, and even phone calls to accommodate seniors without other technologies. Our main selling point is we are crisis specific and we will be making a solution that can last even after the crisis ends. It is the interest of everybody, the mental health of seniors, so we have a lot of potential partners in this venture. Who we are, we got a lot of wide range of technical backgrounds. You know, I myself am a mathematics and statistics student. We got some people in public health, GIS, lots of amazing product designers. I'd like to give additional thanks to our amazing mentors, Nicole, Nikhil, Kavita, and Alex. Thank you.
Ethan, thank you so much. Of the presentation, I'm going to remove, yeah, right on time as well. Remove remote control and open it up for our judges.
I think, how are you addressing the seniors who are not very tech savvy? I mean, how would that play out in this scenario?
Right, yeah, so a critical component of this is like our outreach organizations who can, or maybe even volunteer services who can guide these seniors through these things. You know, even if in the case that a senior were to call through the phone system, it's entirely possible that we have a real person on the other end of the line who can walk them through every single step. This is in the hope that with whatever platform they're using to access the technology, all the assistance is there available for them. And, does that answer your question?
Yeah, it does.
Amazing.
Thanks.
Yeah.
I think it's a really critical need for sure. A nice job on this.
Thank you. Any other questions?
Quick question then.
Yeah.
In the beginning, you said that the outreach, you're going to reach out to certain organizations who are going to tell everyone about your product. So
Yeah.
who are these organizations, and what's their motivation to help you do this?
So we've identified a few mental health organizations such as NAMI and healthcare providers like primary care physicians. Those are the main people we had in mind as far as the outreach goes. It's in their interest because we're all better off if our seniors are mentally healthy during this time, and it might reduce healthcare costs if you're preventing serious things later down the line if they're more mentally happy throughout this. So there's a major incentive as far as reducing the burden on the healthcare system right there.
Got it. Ethan, thank you so much. I think the recommendation there would be to take a very close look at why would those organizations want to recommend this app.
Yeah.
NAMI and PCPs are very, very broad organic like terms or type of people or type of professionals. So just take a deeper look at that. But thank you guys.
You're welcome. Thank you.
Sorry, I muted myself. We're going to go to the next presentation. Let's go. We have some appendix slides here. So domestic domestic violence coming up, and right after this, and pub tracker coming after. So I believe, let me provide access to Arani. Arani, should have access.
Everyone, can you hear me?
Yes.
Perfect. We are distance domestic violence. We want you to meet your next door neighbor, Mary. Mary is in an abusive relationship, but you probably wouldn't have known. In normal circumstances, she would go for walks or visit the mall to get away from her abusive partner. But Mary can't leave the house right now as a result of the pandemic, and her partner has become increasingly abusive. Scenes like this and others occur every 15 seconds in the United States before the pandemic. But with stay-at-home orders and people in close quarters, we expect the statistic to rise.
Gonna go back?
Yes, back please. 2 slides. Next slide, perfect. You can go back, sorry about that. New York City is an example of this rising global problem. Since the stay-at-home orders, a New York City domestic violence website saw a 300% increase in new visitors. Next slide. There has been an uptick of 15 to 20% increase in domestic violence cases. And most of these incidents likely never get reported, leaving institutions equipped to service this vulnerable population with data caps. So what's our solution? We propose a mobile responsive web-based platform, not an app, that will allow people experiencing domestic violence, some maybe for the first time, to take a discrete risk assessment tool to provide needs-based care, whether that's empowering individuals by providing safety plans and strategies to manage the situation at home if possible, or having local providers connect via chat function to those who are at high risk. With geolocation, anonymized data can be shared with existing nonprofits and policing agencies looking to better understand the scale of the problem in their communities and pivot their resources. With many governments promising additional funding to shelters and domestic violence hotlines during this crisis, we know that they too are looking for new ways to expand and digitize their services to better connect to those in need. And this is our prototype. It's a web and mobile-based platform. if you we have a risk assessment tool that uses a slider function for ease of completion, and there's a hide screen option to ensure that the safety of our users is considered. We link users to local resources with options for direct provider consultation. Next slide. We understand that messaging a social worker might be a safer option than calling a hotline at this time, and we've incorporated this feature into our prototype. To wrap up, to execute this, we really want to start with a pilot, focusing on cities where we know there is a rise in domestic violence cases and quickly with scaling up. We want to work with providers from different levels, from nonprofits to web services, local shelters, hospitals, policing agencies who can leverage this data. We're here to work together to connect to solve this problem during COVID and beyond. Next slide is just our team.
Thank you so much, Arani. This is incredible what you guys are working on. I want to allow judges now to ask a few questions.
Yeah, really interesting thing. I think the natural question for me is, where does the screening tool come from? How did you develop that? Is it something that is established or is it new?
So there are existing screening tools in the clinical space that providers use to assess who's at risk and who needs help now. But we understand that with COVID, providers aren't necessarily seeing or sort of being able to recognize the signs and symptoms of domestic violence. So we envision sort of a combination of using existing clinical tools, but also having prompting questions that allow for some sort of introspective reflection from the user who's taking it so that they can understand sort of where they lie on their risk. We know that domestic violence looks very different in different circumstances. Someone might need to be moved from their location immediately. Someone may be sort of just contemplating or just recognizing that they may be in that situation. So we want this tool to sort of be valid clinically, but also sort of leverage sort of introspective thinking for the user.
So how would this be disseminated in a short amount of time, given that COVID is already going on? And how would users learn about this app or service? And how would they be able to differentiate between what may already be out there?
Yeah, so in terms of dissemination, we really want to work with our partners. I'll let Shay take over for that one.
Yeah, so there's a few execution plans that we can go for. One is really working with partners and healthcare centers who are already trying to take care of this problem, and now they have to shift resources. So they really want to start, moving their resources to the correct way and to get data that is correct about how many people in their centers are really logging in and worried about domestic violence. And so as a platform, we'll be able to provide, based on geolocation, the different centers that are in tune and working exactly in areas of the people who are logging in. The second is using social media. So a lot of these healthcare centers and social media is really widespread, so people can sort of log in. Social media advertisement and awareness campaigns is important. And then if we can target the existing platforms of healthcare providers and also geographical hotspots, such as New York, we know exactly which areas have been previously targeted by domestic violence, but also moving forward, we see underreporting and overreporting in specific areas, so targeting those efforts based on geographical location.
Thank you so much, Arani and Chai and the rest of the team. Love what you guys are working on. We now are moving to the next team, the second time. So we have protons coming up. Oh, Pop Tracker, not protons, sorry. And I believe I'm giving access to Jaime, but Davis, you're gonna be the one unmuting. Okay, go for it.
All right, ready on you, Jamie. Hello, my name is Davis White and we are Pop Tracker. Imagine you are one of the over 1 million essential workers in New York City. Jamie, can you use that slide system? Excellent. You're rushing to your main mode of transportation, the subway system, just to get to work. Even though you're wanting to get into an emptier car, you catch a crowded one. After a long ride that increases your rate of transmission while putting on an extra strain on your mental health, you stumble out to realize that many of the other cars were less crowded. Our problem is to find a method to effectively track and communicate information about the local population density in very precise areas, like a section of a subway car, for example. While solutions to this problem exist in public transport, they are rarely implemented because of their high installation and investment costs. So our team aims to cheaply democratize this information. So anyone who needs to go to work or just wants to ride the subway safely can do so with the knowledge of how to avoid unnecessary physical interaction ahead of time. Pop Tracker utilizes a mesh network system of IoT devices that detects a number of people in the subway car in real time by anonymously analyzing the Wi-Fi packets sent out by the rider's cell phone. This inexpensive microcomputer and power source are then held in an easy-to-use casing that allows for quick and easy stick-on installment. The Wi-Fi sensor will then link up to the other sensors in the mesh network to send this data real-time straight to the cloud. From there, this information is stored on our database for our web and mobile applications. Real-time data will allow commuters to choose the least busy section of the train to go to, while our forecast feature will allow proactive users to carefully plan their route before even leaving the house. Our system stands out by being easily implementable in a variety of environments due to its ease of modularity, scalability, and low cost. The community benefits from Pop Tracker because it lets users ride public transportation more safely and comfortably by reducing transmission of the disease in a highly trafficked area. The measurement system itself, on the other hand, or the MTA, benefits for increased sales from greater number of passengers during periods of the off day. Moreover, in the future, after the crisis is averted, the technology will still be useful in data collection and resource allocation, which will be especially helpful when ridership starts to pick up after resource demands drastically increase. Now, if we look at the milestones, we can see the actual next steps we want to do. Broadly, we need to complete our alpha testing, start beta testing on-site at a specific metro station, then integrate ourselves with more of the transportation network. We also have many ideas what this technology could also be applicable, such as grocery stores and other small businesses, and have identified its use as machine learning as a way to enhance our forecasting capabilities. All right, guys, to give you a little bit of background, we are a group of diverse members from 4 different countries and a multitude of educations in engineering, computer science, design, business, and artificial intelligence. Thank you so much for your time. If you have any questions, please go ahead and ask them now.
This was great. Judges, please.
Yeah, really cool idea. So the premise is that all the people riding the train would be connected to the Wi-Fi network. Is that accurate?
Yes, sir. So that would be a sensor model, but our tech guy, Ricky, can then explain a little bit more how that noise could affect the outcomes.
Yeah, so we're basing this off the people that are being connected to the internet on the trains, but however, given that, let's say, children or maybe people that cannot afford cell phones will not be able to connect to the internet, we can just inject some more data into the model based on other historical data collected from other sources.
Got it.
This is a cool technology. Are there any risks? Like, what is the lifetime of the device? How much does it require? A lot of maintenance? And I mean, could someone steal it off the wall? What kind of issues can you foresee?
All great questions. We don't exactly know how the subway cars are set up because there are so many different types, so we'd have to work with the MTA on specific subways. But while we're in the beta testing phase, we work on these problems. But we'd imagine they would not be able to be stolen. And during the beta test, we would probably just put them away in paneling, just out of sight, out of mind. And they wouldn't need any maintenance regularly, I don't think, if they're hooked up to a regular power supply.
I think we're running out of time. I just wanted to say you guys really rocked it on the presentation. Looked amazing.
Thank you so much, sir.
And within 3 minutes, Davis and team, thank you so much. We're going to continue now to the next. So let's go through these. So Dynamic City, we had issues downloading the slides you submitted. So we're going to go to you at the very end and allow you to share screen at the very end. For now, we're going to go to quarantine. And coming up after quarantine, we're going to have Crowdsourcing Compassion. So quarantine, if you could please, providing your chat, who should I provide? Jonathan, okay, let me.
So Emily Ricotta.
Okay, Emily, okay, let me give you access. Okay, there you go.
Perfect. Welcome to Q+. Connect, do, contribute. The problem that we're solving is there's over 3 million people quarantined today around the globe. One of the problems we're encountering is a need for physical distancing, which helps slow the curve, this can have a negative impact on individuals through the health and well-being of them. While people can, of course, Google this information, there isn't a centralized place to find ways of staying at home easy and making it more enjoyable for the vulnerable population, along with the people suffering from boredom and feeling powerless. Welcome to Q+, designed by a great team at Quarantine. After you log in, the app finds tailor-made solutions to you based on the areas you like and use. Ultimately, we'd like to incorporate AI behind the scenes to help improve the solutions and suggestions. If you want to explore different types of activities, you can of course click the Explore tab. Next, you can search for specific options such as exercise, games, kids, meditation, kids games, music, etc. Next, you'd pull up a page with options for delivery, for example. You can also favorite apps to refer back to them later for quick access. These fun educational screens will display a few seconds in between each transition just to give you some education on what's going on at the time. Q gives people a centralized point to find unique entertainment, positive news, health and wellness activities while encouraging people to stay inside. While doing this, people will be earning points, which they can use to donate to charitable causes, to give them a sense of empowerment. This will impact people in a number of ways by helping to reduce virus transmission, improving overall wellness, educating users, along with empowering people to feel like they're making a difference in this time. The end users we feel could be anyone, especially targeting high-risk individuals needing to have everything delivered at the moment, but also people of all ages looking for a place to simply find entertaining activities to stay connected socially while making it more enjoyable, keeping the physical distance. The way we have the business model set up is with the partners, it's increasing sales by people going to shopping, as we call it, retail therapy. Product being brand loyalty, they get to see this retailers more often, along with points being rewarded to the users for spending more dollars, for absorbing more content, for buying more apps, etc. In doing this, this will also be a place where we can use MIT challenge apps to add to it and keep featuring them.
And
the team, we've had a great team put together from around the globe, a lot of medical background, along with some very good people involved in UX design.
awesome, Jonathan. Thank you so much. I'm going to remove remote control access and open it up for 2 minutes of Q&A.
Yeah, sounds great, and I think you said this in the beginning, but it went too fast. You're going to use machine learning. How are you going to pull all the possible activities that someone wants to do? So again, what's the curating mechanism for what you see?
Yep. So initially, the easy road and the way to launch quickly is we're going to curate this. We're going to find the top 10 apps in each division. So simply put, bring those, upload them, get people to go there, get top 10, validated apps, et cetera, ways to create positive news, et cetera. We're going to curate that. Eventually, we talked to one of our mentors, and she said, we could use AI to help curate that better as time goes on.
So it's usually pretty hard to develop stickiness as far as curated content goes. People have their own strong preferences. So how do they bring in their preferences and the places that they go to for such type of content? How do you sort of gently channel them away from those places to your app?
Yes, I think the main goal behind this is to give people a feeling of empowerment and being able to give back and help in these times that we're at. And then basically by doing this with the top apps they're already using, TikTok, Facebook, Instagram, and then of course channeling positive news, because we all see a lot of negative in the world, but how do we keep people coming back is through positivity, reinforcing that you're giving back to the community, and then the partners and sponsors will of course be pushing this out as they're giving and donating. Then others can do it at the same time.
Thank you so much, Jonathan. Thank you so much, team. We will now continue with the next team. Let's Crowdsourcing Compassion is next. And then after that, we'll have the Invisible War. So for Crowdsourcing Compassion, I believe I'm giving access to Rachel. Rachel, you have access to the screen.
Awesome. Can you hear me, Alfonso?
Yes, we can hear you.
Okay. We're the Crowdsourcing Compassion team, and we're here to present Telewell. Meet Rochelle. She's overwhelmed at home with her kids, out of work, sad snacking. She hasn't exercised in weeks. Wellness is the last thing on her mind. From experience, our team knows that there are many like Rochelle around the country, but to test our hypothesis, we conducted many interviews that confirmed American lives are severely disrupted by COVID quarantine and stay-at-home measures. COVID is spreading. We'll soon surpass 300,000 active cases in the US, patients who are struggling both with symptoms and isolation. Additionally, there are currently shelter-in-place orders for 1 in 4 Americans and stay-at-home advisories around the country. Enter Telewell. Inspired by the stories of compassion during this crisis, our team has created a centralized portal that allows users to care for others and contribute to their community. Telewell harnesses the love and talent of individuals to provide purpose and meet needs by volunteering to assist others or connecting for entertainment and education during this crisis. Literally crowdsourcing compassion. Our primary stakeholders are COVID-19 patients as well as anyone who is distancing. Both are vulnerable to mental health issues. We'll know Telewell is working when the user is able to meet the needs of others and themselves and their communities using our service. To see how Telewell works, let's check back in with Rochelle.
So Rochelle signs up for Telewell and enters her details, schedule, language preferences, skills, and interests. Now she can make a request, offer a service, explore paid work, and check out online events. Once posted, our matching system offers the user matches in an engaging swipe left, swipe right format. Rochelle tried Facebook and Craigslist, but it was way too much work, and Telewell does the work for her by matching her with great people and events. Rochelle is monitoring her matches on her smartphone app or through the full website using her desktop and chats with any matches that she gets. Across the country in Miami, we've got John. His gym is closed and he's at home. He's passionate about fitness and wants to connect with others, so he signs up for Telewell. He offers to host a workout online and matches with Rochelle, who's looking to exercise. So thanks to Telewell, they work out together and improve their wellness despite COVID isolation. Rochelle gives her feedback so others know that John is great and the Telewell community grows. And we're envisioning a business model that integrates funding through the monetization of the website and through advertising. So although Telewell has altruistic benefits, the economic benefit of improving wellness for up to 75 million people in distancing at home is high. At a time when healthcare systems are overrun, empowering communities to take care of their mental health reduces the burden on healthcare workers and improves health outcomes. We have developed a regional rollout plan to allow testing for time for testing and fixing any issues that may surface. In the early weeks, we anticipate developing through the first month and rolling out a trial in 1 US city after 5 to 6 weeks, with more iterations to come, which will highlight additional features like events calendars and gamification. So meet our team. We are a multidisciplinary team built of designers, engineers, clinicians, program specialists. We're creative and compassionate. We work together well, and we are well positioned to bring Telewell to the public. So moving forward, we'll be exploring additional funding options and functionality, and we'd love for you to join us on the journey. So thanks so much for hearing us out. Let us know if you have any questions. And if we could keep control since we have some backup slides, that'd be great.
You got it. You got it. 2 minutes of questions.
Yeah, thank you. And sounds like a great solution. I have one big question, because you also mentioned in the end, bring to the public. How do you launch? And because to get enough matches, you need a lot of people to start using it, correct? So what's your launching strategy?
That's a great question. Rachel, you want to take that?
Absolutely. We have a detailed marketing plan in place that involves not only reaching out to local organizations such as the VA or groups like Meals on Wheels to be able to begin developing the side where we're getting people asking for assistance, but also churches and other volunteer groups that will allow us to build out the site with volunteers. We then also plan on supplementing with advertising on places like social media to be able to build awareness of the brand and bring it to a broader audience.
We have time for one more question. Okay, I gave the judges 15 seconds solidly, so I'm going to allow that to be no more questions at the moment, and congratulate you guys for an awesome presentation. I'm going to remove control now. Rachel, if you can not move the mouse.
Thanks, Alfonso.
You got it. You got it. Thank you. Okay, so we're going to go now to next team. The Invisible War. And for the Invisible War, I believe I was, okay, so Brandon.
Yep.
Let me give you control. Give me 1 second. Great. Go for it.
Wonderful. Great. So first, thank you all for giving us the opportunity to present to you, and special thanks just to all of our mentors and advisors for their invaluable help. So today the world is fighting a very visible war against COVID, but there's going to be a second invisible war fought in the months ahead as our communities struggle with the psychological impact of quarantines and social distancing. So our proposal, if we go to the next slide, is focused on one very vulnerable population, which is the US veteran community. So the stressors of the pandemic are going to be particularly dangerous for veterans who already are far more likely to suffer from mental illness than the general population. And in light of the forced shift to telehealth around the country, we've heard firsthand and from government sources that the VA system is going to be overwhelmed, both in terms of personnel and in terms of bandwidth in their systems to serve this enormously increased patient population. So we believe that requires a new paradigm for treatment to save lives and prevent enormous human harm. So our solution is a simple veteran-specific technology platform that we're calling Pandemic Pledge. So the idea is to connect low-risk VA patients who need mental health care to pro bono private providers who are likely sitting at home with lower patient loads due to the disruption of COVID. So I'd like everyone to imagine low-risk Joe, who's a veteran quarantined at home. So he probably doesn't have a history of mental illness, but he's feeling anxiety and depression about the crisis and wants support from VA care providers, but probably is facing long delays because he's not a critical patient. And he's probably fine for now, but the longer he goes without preventative care, the higher his risk is of developing serious mental illness. So our solution is a bridge between the public and the private sector to provide a preventative healthcare solution for veterans for the duration of the crisis, which will let the VA focus their resources on high-risk patients who need specialized care. So very briefly to explain how this would work, we're going to repurpose an existing mental health matchmaking platform that exists today in partnership with the VA to connect volunteer healthcare workers with veterans who need care. Be on a third-party system to reduce the bandwidth constraints, and each providing partner will sign the Pandemic Pledge, which is an agreement to provide care on a pro bono basis for at least a 3-month term to ensure continuity of care. The VA will triage patients entering the system, and low-risk patients will be sent to the Pandemic Pledge platform to be matched with a volunteer provider, while obviously high risk continues to go to the VA. And at the end of the term, patients and their documentation will be routed back into the triage system for reevaluation. So very briefly, how do we launch this? So first, based on discussions with relevant stakeholders, we really think this can be launched rapidly and there's an appetite, and it's 3 simple steps. Pilot with an opt-in population of volunteers after identifying kind of providers in the platform. And then once we know this will work, it's going to be about expanding it nationally to all interested credentialed provider networks and to the veteran population at large. Thank you very much.
Great. Yours went off before mine, but maybe I just gave you a couple of seconds extra. Thank you so much, Paul and team. I'll now start the 2 minutes for the Q&A from judges.
Generally, when there's a change in care, or when there's a continuity of care issue where when you have multiple providers and there's a transition of care that happens, people fall through the cracks. And given that this is a very vulnerable population, how do you ensure that as the patient bounces off from VA to your platform and then back to VA, that you would have a good plan for continuity of care?
So that's a great question. The way we're thinking about this is first, the system's going to be set up to kind of do a minimum viable product in terms of records transferred. And the way we're going to mitigate it is this is only going to be the lowest risk patients who go into the system. You know, obviously the platform will hopefully be able to provide for that continuity and avoid errors. But the idea is were an error, God forbid, to be made, especially as this is piloted and brought up to speed, it will be with a very low risk population within kind of the spectrum of mental health support.
Thanks.
For the veterans that get triaged into your system, do they have any issues having their VA healthcare, VA insurance pay for private providers?
So that there are two things there. The first is this will be done on a pro bono basis by private sector providers, and just from conversations, it sounds like there absolutely is appetite and capacity for that, which avoids some of the issues around that. And then the other piece is we're just looking at the CARE Act and some of the other emergency changes that are happening as a way to get around some of the complexity of traditional reimbursement challenges. I think you're already seeing that in kind of primary care environments. And we think the next logical step is that's going to be extended to the mental health realm as well.
Paul, thank you so much for the presentation and team for the efforts over the weekend. This is awesome. I really hope that you leverage the VA partnership that we have through the MIT COVID-19 challenge.
Great.
Now we're going to continue to COVID-19, and I believe, and then coming up we'll have Moose. I believe, John, you'll be taking control for COVID-19?
Yes, sir.
Okay, you got it.
All right, so my name is John Cole. I'm with COVID-19, and we make it easy for people to make smarter social distancing decisions. There we go. Oh no, you downloaded it before I took the actions out. Okay, give me a second here. It had transitions in it, but we've since added it. I thought you were going to do a live link. One second.
You want me to help you flip through them quickly?
Yeah. I mean, if we can get it without the transitions, that would be helpful. Okay, so we're only as strong as our weakest link. Lack of concern by just one individual can compromise thousands. And so unfortunately, there's many people out here that don't take this crisis seriously. They go about their lives ignoring the precautions in place by institutions of authority, putting themselves and countless people in danger. So our idea was to build an app that would allow people to basically let their social distancing efforts be known. A simple app that lets people share their location and input various social distancing measures. We can tell people, how likely they are to contract the coronavirus, and also how many people they could potentially infect if they go to places like Walmart or a convenience store, go on a jog, or so on and so forth. We can also tell them how many lives they could save by not going to these places, and then allow them to compare which measures are ineffective or effective. Let's go to the next slide. So this is just a couple rundowns of what happens when social distancing is not practiced. You can see in a 30-day period, one person can actually infect 406 other people. Go to the next slide, please. And so we can see a 50% reduction, 30-day period, 15 people. In the next slide. And 2.5 people in a 30-day period with 75% reduction. So we can tell that social distancing works, and it's very important. So we need to help people understand how important it is, and motivate them to follow the guidelines. Go to the next slide, please. So this is what's happening for a hospital. We have a population of about 180,000 people. If we did 0% social distancing, we would have 650 patients in the ICU over a month. If we applied that to United States of America with 0% total distancing, we'd have nearly 1.2 million people in the ICU. So it's obviously very important. Next slide, please. All right, so this is our solution. Essentially, we get our data from things like the infection rate, population density, mortality rate, and so forth. And so people can go on the app and input different variables and their location, and it'll allow us to determine things like how likely they are to get infected or infect others, their death risk factor. We can tell them how many lives they've saved potentially, and things of that nature. Go on to the next one.
Oh.
All right, so there's two ways of thinking that people we can help with. So one side of the divide is people who don't care. So what we can do is we can either have somebody send them their results, or they can actually do it themselves, and it might encourage them to look into it more. So basically, those persons that don't care, we can help them see that their actions could have dire repercussions. Then there's the other people that don't care too much. Or they care too much. They're scared and they don't want to go out. So we can put them in the platform and allow them to compare what they're currently doing towards the community. So if we see that their actions lead to a much more secure and less impactful way, then they will actually be able to see that and be a little bit more calmed down.
Thank you. Thank you, John. We're going to open it up now for Q&A.
So I think you still have the problem that people who don't care are likely to not download this app, right? People who care would probably, download this. They're more likely to download this app and be more aware. But people who don't care, how are you gonna? Can you reiterate how you would basically get them to download this app?
Yeah, and so they don't necessarily have to download. What is happening is people more likely in their family, friends, connections, they do care. And so what they can do is they can actually input that person's variables and actions into the app and send it to that person and actually show them.
We have time for one more question.
So can you clarify, do you actually use some live data to show people who they might meet while they're out and about right now? Or is this what exactly would someone see?
Yeah. So if you can go back a slide, or actually go forward a slide, I believe. No, never mind. Anyways, so basically we take our data from, we take the population density, we take the infection rate, we take, how many people are out at a given time for a particular, like if they're going to a big box store or they're going out on a jog, we can kind of determine how many people are going to be out there. And we take all those variables and basically do a mathematical equation and give them percentages as far as their chances of actually becoming infected. We take that rate of their infection rate and then kind of extrapolate into the death rate. And then also we take the potential of them getting infecting others as well and put that in there as well.
Thank you so much, John. Now we're at time for the Q&A. We'll continue with the next team, but awesome work here.
Thank you.
So our next team is Moose, and after that we'll have Safe Hour. Moose, I believe you want Ximeng to control the slides, and you should have access.
Let me try it.
Hi.
Yep.
Hi there. Okay, it's working. All right.
All right, 3 minutes.
Oh, can you hear me?
Yep.
Okay. Hi, we're Moose, an time-banked skill exchange platform, the social media for social distancing. To help stop the spread of COVID-19, society has implemented the practice of physical distancing. According to Mental Health America, this has caused a 19% increase in loneliness and depression, especially among the more vulnerable populations, such as immigrants. And our solution is to create an online skill exchange platform where people can feel connected to others by exchanging skills or knowledge. Users who provide a skill can earn time tokens as a currency to buy other skills.
We'd like to introduce you to Jenny. Jenny is a Latina immigrant who has to be vigilant about self-isolation. She has a pre-existing condition. Social distancing has caused Jenny to feel depressed, isolated, and anxious. In the pre-COVID world, she worked as a music therapist, but she can no longer see her patients. Jenny seeks purpose, and as an ESL speaker, she'd like to keep up her English while isolated. The world has forever changed. Maybe Jenny can use this time to change too. Enter Moose. Jenny joins the platform and she practices her English with Mary. Mary earns time and she uses it to pay Sandra to teach her to code. Sandra uses her time to have a chat with Doris. And Doris hires Jenny, who is now giving music lessons. As you can see, the economy is circular. Moose's value for stakeholders directly contributes to current market needs. Moose mobilizes users to stay home while providing a purpose, as we saw with Jenny. When we stay home, we flatten the curve, easing the burden on our healthcare providers. When we find purpose, research done by Pew shows outcomes of better health and lower rates of depression and anxiety due to resilience. There is no question that COVID-19 has also caused a mental health crisis. Finding purpose or knowing that your vulnerable loved ones are a little less alone at this time can ease the burden for mental health professionals.
So on the left, we have a demo of what the Moose Skills Exchange platform could look like. And on the right is a preview of what we have prototyped so far. We are using AWS Chime SDK to embed video call functionality into our website. Moving forward, we will need support from AWS services, leverage transperfect.com for data management and consulting, and get community buy-in to establish a user base. These are the tools we will be using to build out our platform. So we are the Moose team, which stands for Mind Opening Online Skills Exchange. Thank you so much for listening.
Awesome. Thank you so much. Great presentation and within the time frame. So now we're going to do 2 minutes of Q&A from judges. Please go ahead. I'm going to take back control.
So there's a great solution, by the way. The key question for me is that, you know, people have different levels of skills. So you have somebody who is a native Spanish speaker, for instance, versus somebody, a high school student who's learned Spanish for the last 3 years. How would you qualify or, you know, reward expertise? I mean, that people who are not just the time that they put into this platform, but also the amount of expertise they have in a given skill.
Sure, thank you for your question. That's a great one. So there's a learning curve, of course, and I think that there's a lot of compassion that needs to be given on both ends, but we also would like to implement a rating system. So after you, if you take an hour of a skill exchange, we'd like to, like an Uber rating, essentially. So 5 stars and you can leave a comment. And if you see that something's a waste of your time, then you can, you know, log off and be compassionate about it. And I think that even the best teacher will get stage fright, and even the best performer will get stage fright. So there needs to be sort of a learning curve and compassion behind that.
Okay, great. You guys are running close on the time frame for the Q&A, so we're going to continue the next team. Love what you guys have done. I saw this yesterday. Well, not yesterday, this morning. That was a pretty quick change. Amazing work. Now we're going to continue to our next team, Safe Hour. After Safe Hour, we'll have Darwin present. And Paul, I believe you requested access. Hello. And
can you hear us?
Should be all set.
Oh, sorry.
You want to go back there?
Yeah,
yes,
sorry.
Okay, there you go.
Can you hear us? We're 3.
Yeah.
Hello. Can hear you.
Okay, cool. So welcome to Safe Hour.
Yes. So we identified the problem as being that even if confinement is necessary to flatten the curve and have an effective impact on the pandemic, we all have some basic needs that force us to go outside and in public spaces. for example, going grocery shopping. And we think that everybody should be able to pursue those basic needs with a minimal exposure to the virus. Our question was therefore, how can we combine these needs and the necessity for confinement?
Think about Henry. Henry is a 20 years old student. His classes have been cancelled and he's confined with his family. As his parents are too occupied with working remotely, Henry is the one in charge of buying food for the whole family. So Henry goes to the supermarket, but there's usually quite a lot of people there. Henry is thus very exposed to contamination, and he risks to contaminate his family or other persons in the store.
Safe Hour is a web application we built that lets you, the user, pick your favorite places you have to visit during confinement and social distancing. Those places usually include supermarkets, pharmacies, or even banks. Through the application, the user will see the number of people currently in the public place they want to go to. Based on that, the user can make an educated decision about whether or not they should go now or later to avoid being exposed to the virus. Our goal is to increase the efficiency of social distancing precautions, such as the Parisian confinement. So after logging in, the user will be exposed to the dashboard where he can input favorites, which will redirect him to Google Maps, and he can look up his favorite supermarket or even a bank. There, he would add them to his favorite list, and then he would have the option to go to that place. So for example, go to the supermarket where he would get the information about how many people are currently there. If he decides to still go, the database would be created to increase the number of people at that place, and he would have a timer that indicates how long he's been out. When he comes back, the database would decrement the number, and if he decided not to go, he can consult the heat map to decide where are places that are less crowded.
To improve our web app, well, first we want to make a fun app and improve our web design. We also would like to implement some machine learning that will be able to tell the user the safest hours to go to his favorite stores. Finally, we would like to take more in account the size of the stores to be more precise in our risk prevention. To implement Safe Hour, we want to reach possible users by working with stores and by reaching them through social exposure. We also think that word of mouth will be a key factor. And finally, maybe getting an official approbation will be a way to gain the trust of possible users.
So we have two requirements for this to work. First of all, we need all or most users in an area to use the app and to download it and to be trustworthy. So they have to indicate when they actually go to those places. We believe that exponential adoption would make the service feasible. Our revenue could come from government funding since they are taking precautions to fight this virus, or running ads. As you can see, there's a lot of white space on our website, and we can run ads to help businesses during this time of crisis.
So we are 3 undergraduate students in second year, 1 from Columbia and 2 from UCL, and we all have a complementary and interdisciplinary background that convinces us that we will be able to further deploy and develop this application and this technology.
Thank you so much, guys. Awesome presentation. I'm going to remove control now. If you to move the mouse for just a second.
Oh, sorry, my bad.
So we'll open it up for 2 minutes of Q&A from the judges.
Yeah, thank you. Sorry, go ahead, Prashant.
No, please go ahead. Go ahead.
Yeah, the one thing I immediately wondered was, how do you know whether there are people in these places? And apparently it's by everyone having the app. So you said it really quickly, how you're going to make sure that everyone has this app. So that's my first question. How do you make sure? And then you mentioned heat maps. And I was wondering how they tune into this as well.
Just a quick comment. We already have a MVP built, so the adoption and deployment of the app could go very quickly. And Nicholas, if you want to continue.
And yes, for the we are aiming to have a community adoption, and so focusing on small scale. And by addressing at first, for example, a supermarket, which is kind of a hub in a community, we would think that it would spread more easily inside this community, and people going to this supermarket would be more, would tend to go to the same bakery, to the same bank, to the same pharmacy. And so the number of people will increase in this community. And so there will be, at a small scale, enough people for the app to be significant.
And for how it knows, basically, when I indicate that I go to the supermarket, our database gets, the number in our database associated to that place gets incremented and then is available for other users.
So the need is very clear. There's no doubt about this. I mean, this is a fantastic concept. I think the one piece of feedback that maybe I would give is you're depending on people to actually use the app and log in. I think that part needs to be automated, either using sensors or some other mechanism. Otherwise, if everybody doesn't do it, then the concept then starts to break down. So that's one piece of feedback that I would give. Yeah.
Thank you very much.
Thank you so much, Prashant. I completely agree with that. And team, we need to continue. But for judges, when you guys have any feedback, by all means, please provide it, because these teams are not only here to present before a challenge for a prize, but are here to make an impact. So thank you so much, Prashant. So our next team is Darwin. And after Darwin, we have Coracle. Oh, Coracle. Nice. Coracle. Okay, so for Darwin, I will give access to, I believe, Maitan, but I don't find you. Oh, there we go. Maitan. Great. All right, so you should have access now.
Okay. Let me try.
Yes.
No, not yet.
You definitely do. Try to click on it. If not, I'm going to flip.
Oh, right. Okay. So, well, good afternoon, everyone. We are Team Darwin, and we are here to help small and medium enterprises, SMEs, survive this period of turmoil. So COVID-19 has had a highly negative impact on many SMEs, such as convenience stores and plumbing services. In a survey conducted by Goldman Sachs a few weeks ago with SME owners, most of them said that they already felt the impact of the disease and had a lot of uncertainty regarding their business survival. Social distancing does not easily align with the SME's business model. As these companies have liquidity problems, they rely on gig economy and don't have enough capabilities to adapt this challenging environment. So mitigation strategies have been put in place. They are majorly palliative or low impact and low key. There's an urgent need for an action which is both revenue generating and high impact. Our proposal is SME Evolve, a one-stop shop platform which will enable SMEs to partner with big tech during this social distancing period, offering goods and services through support local businesses sections, ads, stories, etc. Attractive discounts and benefits would be given during the crisis period and negotiated afterward. For SMEs, this is a great opportunity to generate revenue, customer loyalty, or to learn. For big tech, supplier loyalty, and also to achieve ESG goals and improve reputation. So what does this mean for an SME during the next 3 months, or as long as the crisis lasts? If you're a convenience store, you can pay reduced fees or be part of the Instacart platform, for example. You can attend online financial training by the SBA, which is the Small Business Association, and others. Understand how Google Ads credits work. If you're a plumber, you're not allowed to perform your daily work. YouTube can support you to create a channel. Uber can transport tools to your customers. And also you can use any other platform to advertise your emergency services. This is the plan we want to implement in the next month. Part of the team will be focused on establishing partnerships with and engaging SMEs and big tech companies, and the other part will be in charge of building the platform. This is our multicultural, diverse team, and join us to support and help the SMEs win. Thank you.
Thank you so much. Now I'm gonna remove remote control, and I wanna open it up for 2 minutes of Q&A.
Thanks for the presentation. Can you give a little bit more information about what would happen after social distancing periods end and what changes at that point?
So we spoke a lot about this. Today, there's no platform aggregating the SMEs. There's no exact platform which is really relevant with high impact aggregating SMEs with big tech. There are some initiatives, but they're basically a low key and low impact. So what we want to do is transform this into a space where these companies can interact. And we know that big tech companies have a lot of ESG issues. Amazon not having been treating their workers fairly or not having been good to small businesses. So we find that this would be a place where they could temporarily provide relief to these small businesses and in the future partner with them also, providing them some opportunities, less lower fees and lower discounts. It could be like an SME club with big tech.
Yeah. Yeah, and also we believe that this platform will be viable after the social distancing, because many SMEs will need to evolve to the next phase of working online and having online presence and working on online delivery. So we believe it's a very relevant platform even after the crisis, and it will help SMEs to evolve further in the coming phase.
Basically, this model is sustainable. By aggregating these companies, this will help these small companies in the short term, but also to keep on evolving in the long run.
So if there's, go ahead. Now you go ahead.
Okay, so how would you convince the big tech to actually lower the fees or do something? I mean, what's their incentive?
So for this period, it's basically a relief. It's like aid. You're helping small companies survive during the COVID crisis, and after that, it will be negotiated with the groups of SMEs. So right now, it would be convincing them through helping this sort of campaign with
Yeah, and
the SMEs.
On top of that, there's also this aggregate of reputation. So that's the caveat. Aside from helping, like Amazon can just leverage this to in a way that they are supporting small companies, and that's the caveat that is also there for them.
Thank you, team. I'm gonna have to jump in as we're above time now, but great presentation. We're gonna continue to the next. Coracle, and after that we have Fede. So for Coracle, I believe we have Romesh. Gosh, you have two. You're on Zoom twice, I believe, but also like the first one I see.
Yeah.
Good.
Okay. All right. So we are Team E15. Coracle is just our project name. Can everyone hear me all right?
Yes.
Okay. Just not switching.
I'll switch on your behalf.
All right. Thanks. So our problem statement was many models of coronavirus exist, but many of them are overly broad. They apply to state or federal levels, or even across the world. So this uncertainty can lead to complacency in local communities where people think that, you know, coronavirus is not an issue because I live in Idaho, I live in Montana, or I live in a suburb. So this complacency leads to flouting social distancing guidelines, spreading misinformation online, and also unnecessary anxiety that leads to essential medicine shortages if you subscribe to some misinformation, crowded grocery stores, and mental health issues. Can you switch? Can you switch? No. So our solution, our proposed solution is we propose a simulation based inside a mobile app that takes in a user's location, predicts peak times and infection rates for that area. So our simulation implicitly detects a number of factors about the communities, including differing infection death rates across demographics, population density, number of households, and also some racial data. More importantly, our system can provide simple data-driven advice to the user. So it acts sort of like a traffic light is the feedback we got in our practice pitch. So it tells you whether to go out before infection rates skyrocket, when you should stock up, and when to wait for your local peak, and you can survive on the food and supplies that you have. Switch. So this is we use the SEIR model. It's a well-known viral model. These are just for differential equations. We use the specific aspects of each community to estimate some of these parameters like beta's infection rate and also the death and recovery rates. So that's how that works. Next slide. We'll skip this slide. So we also thought about using smartphone movement as a measure of exposure to high-risk regions. So this is an example of a paper where they did this. Obviously, communities are not independent of the outside, so we need to take into account some outside factors about infection rates and things like that. So we decided to use smartphone movement as a measure of exposure to higher risk regions. And features like local traffic density, age distribution, and association with risky demographics were used to communicate the level of risk that people were at to them. Next slide. So as you can see, hotspots are very concentrated, and federal and state guidelines do not always work for individual communities. These decisions need to be made at the local level, and people need to know how exactly is coronavirus going to affect my community.
Thank you, Romik. Now I'd like to jump on to potentially just do your last sentence to close out, and then we're going to open it up for Q&A.
Can we go a couple slides in advance? I just want to show the app output.
Yep, there you go.
Yeah, so it's very simple as you can. It's very simple as you can see. You just input your zip code and your age. We calculate a risk index, and we show you a graph of how coronavirus is expected to perform in the region, and give you some basic advice based on. It's hard-coded right now, but we'd like to extend that to reinforcement learning or something else within our simulation.
Great,
Yeah.
Thank you. Let's open it up for Q&A now. 2 minutes, or for feedback as well, please.
So why would a user trust your app versus the public information that, there are a few websites that do some of the prediction of how COVID-19 is going to evolve. Are you harvesting those sources as well, or are you providing an alternate model? That wasn't clear to me.
The difference between my model and those sources is the level of detail. Largely, I've looked at some viral models, and they're usually pretty large scale. You wouldn't be able to look at your neighborhood, or even if you're in like a smaller place, you wouldn't be able to look at your city. Your local government usually doesn't have those resources. So adapting the model from being in a paper to being something that people can easily access and understand is kind of the goal of this app.
So you probably have another audience for your app, which is state and local governments as well, right? Other than the individual users. Yeah.
We were told to focus on a single audience, so we decided to focus on the individual, but it definitely has potential to build out for other audiences.
Got it. Thanks.
Yeah, at the same point, actually, and I can see the earlier advice, but maybe, so you're both having developed a new model, but you're also creating an app for everyone to use. That's actually 2 products you're creating, but that might, which would be great, but it's also going to be hard to do that with one team. One thing I wondered about the model, and I'm not a scientist in that sense, but what about the amount of testing available?
Yeah, it's obviously lack of testing is a huge issue in terms of model development, but we're using models that worked on the entirety of the history of like Chinese data, Italian data, things like that, places that have already played out with much higher scale testing and things like that. So we've taken that into account in our model.
Thank you, Romik. That's the time we have for Q&A. I'll reemphasize what Mark mentioned. I think the concept of you going, depending on the user that you focus on, you'll have to develop a different product. Going directly to consumer can be much more complicated in some instances than going to local governments. But great progress here, and keep thinking about who to focus on that could get value out of this type of more granular model. We're going to continue to our next presentation, Fede, and then Hikma Health is our second to last presentation. So we have 3 presentations left. So stay with us here. These are really cool. Fede, let me see. So you did provide a name, Massimo. There we go. Okay, Massimo, we can hear you, and you should have access now.
Let's see. Yeah. Okay, so we want to present the story of Giuseppe. Giuseppe tested positive to COVID-19. He's asymptomatic but forced to stay in quarantine. He is demotivated in achieving his daily goals and keeping to his routine. And he feels guilty because of his very low productivities in these days. So he can't do this anymore, risking to get confused, anxious, or maybe depressed at worst. At the moment, there are 1.3 billion Giuseppe around the world, meaning that we could all be Giuseppe. This team, we are all from Milan, one of the cities most affected in the world, and that just entered into its second month of quarantine at the moment. So we know this story and we wanted to react doing something to improve the situation. So Giuseppe needs help, needs something that led him to overcome the crisis. Our solution is a tool which motivates people at reaching their goals. Many studies, in fact, demonstrate that it is of vital importance to maintain a daily routine and objectives. So basically, our solution is based on the power of sharing. In fact, in our normal life, we are used to share moments, experience, goals with friends. So basically, our app enables it again and provides even more. Fede, our app, offers, first of all, free access to personal assistance provided by professionals. Secondly, official programs developed by the app. And third, the possibility of developing a non-program to be shared with other peers. So these programs basically will establish 3 different communities with chats, webcams, feedback space, challenges, the possibility of settlement, common agenda between users with the same interest. All this in one place, user-friendly, with easily available information that could allow Giuseppe to overcome the isolation period. The business model, at first we try to get both government and private sponsorship. The focus will be on those firms who are already providing their products or services for free to support people in isolation. Is something that is taking place at the moment, at least here. The first version will be ready within 1 month. A great movement of digital solidarity is going on in these weeks. We would like to exploit it, basically. There won't be any charge on the customer. And we have chosen as a beachhead market Lombardy, our region, which is ideal considering its population around 10 million and the several weeks of quarantine in which it found itself. Lastly, within 6 weeks, more or less, we have planned our app to be spread nationally and ready to go viral. Thank you for the attention.
Perfect timing, team. Thank you so much. Really happy to see where you guys have taken this. Saw this earlier in the weekend. I'm very excited for what you're building. I'm going to remove control access now. If you not move the mouse for just a second. Oh, and that's the team. You guys should have definitely covered that. Okay, so judges, you got 2 minutes for feedback and questions.
I have one. So you said there's free access to professional courses. Who are the professionals and why are they free?
Hello everyone, I'm Andrea, one of the team. So we thought that there are plenty of category association like psychologists, doctors, or nutritionists, or life coach, or whatever, who are actually in this moment providing their services for free in order to overcome this situation, to support the people in isolation. So those people will be our main focus during the weeks of partnership development, and are the ones that we would like to put into our app and provide trainings and programs.
One of the things that you may want to consider is how you need, your app depends, or your platform depends on a lot of people, some sort of a critical mass. For it to be useful, you need to probably consider how you can on-ramp very quickly a large set of users for this to actually work. So that's something that you may want to think about.
Yes, this is something that we consider, and but we also take as an example one of the app that the region of Lombardy provided a few weeks ago, and it spread all over the region incredibly fast. In few days, basically all the people in the region had it because it was useful for them to let's say to support them to overcome this period. So the spread was incredibly fast. So we believe that this app will have similar timing of spreading.
Thank you so much, Andrea, and thank you so much,
You're welcome.
Judges. We're gonna continue to our second to last team now.
Yes, hi Alfonso, this is Sinan Ibrahim from Hikma Health.
Okay, let's give you access.
Hi everybody, thank you for this opportunity to present and share our work with you.
All right, you should be all set.
Okay, perfect. So hi, I'm Sinan Ibrahim and I'm representing the Hikma Health team. We are a 501c3 tech nonprofit that normally makes health data solutions, basically EHR software for refugee and low-income patients around the world, but we've been called to action, as all of you have, by the ongoing pandemic that's affecting communities not just around the world, but in our own backyard. Thanks. So as we heard from Ramik just 2-3 teams ago from the Coracle team, people really want to know how things are going for themselves and their families and their neighborhoods in their own area. But a big question mark for us, the project we actually initially started with was, let's try to model epidemiologically what's going on with all the data sets out there. But a big question mark was, what is the impact of the policies in place? All of the epidemiologic models that we saw, including the Imperial College one that you might be familiar with, they all have this implicit assumption that policies are standard. Now, in the US, unlike a lot of the countries from our international friends, the response has actually been very much state-based because unfortunately, the federal government has only put out limited guidelines, usually later than anticipated. So, and in some states like Florida, for example, the response has varied very much on a county level as well. So to answer the question of what policies will be effective to spread the, prevent the spread of the virus in my county, we have a missing data problem, which is what are all the policies that have been used in different counties, specifically for schools, workplaces, public transport, and the like. Have those elements all been shut down? And to date, there is no visualization or data set for those policies. So we basically are in the process of creating, our software engineers are still finishing this up, but this is our prototype, where basically we have a map-based framework where we will source data from all of the public health departments in these counties. And we're going to start with the high-risk counties. And we will have, as you can see here, for the education, we know that schools in Cambridge are in Middlesex County are closed, required to close. So we're going to source all of that information for all of the different policies. And then if I'm a mayor in small town, Illinois, I can actually go and say where what has been done in counties that are very similar to mine. And we're also, our data science team is working on a county clustering app so that it'll show me, when I click on my county, it'll show me counties all around the country that are demographically similar to mine and are perhaps at similar risk for spread. So then when we integrate the Hopkins map to show a heat map of where coronavirus is spreading, we can pick policies that may have worked in counties that are similar to mine. So we believe that this product will greatly inform county leadership in policies. Just as a timeline, we basically spun up this prototype in the span of a week. And after collecting policy reports from 100 counties, we're going to make this publicly available. And our eventual goal is to render the epidemiologic models. We're a diverse team. Several of us are from Hikma Health. Others we picked up from this MIT hackathon community. So thank you again for offering this as a great resource. And thank you all for everything you're doing together with the power of data. We'll all be able to stop this pandemic. Thank you.
Thank you so much, Sinan. So we're going to open it up for Q&A. One thing I'll mention before Q&A is you should look into a group of faculty at MIT that have set up something they call the COVID-19 Alliance, which effectively uses crowdsourced data from multiple data sets to identify risky counties to inform public officials on how to make decisions, not necessarily at the local level as you're talking about, but their mission is very similar to what you're trying to accomplish here. So take a look at what they're doing as well.
Thank you. Definitely will check that out.
Yep. All right, so 2 minutes of Q&A and feedback.
Well, working for government, this is really great. I also like the way you explain it. I think it's very important, and this is a big issue at this point. The only thing I wondered, great job. Only thing I wondered is how are you going to source all the policies from the different counties and not do it hand by hand?
Yeah, thank you for this question. We wrestled with this a lot, and the three options we considered were basically looking at news articles and public declarations on the county health websites, and we found that those are highly variable, and there's not really a good natural language processing tool to do it, so it'd just be too laborious for our small team to efficiently undertake. The second option we considered was crowdsourcing it from the public, and we were actually well down that route. We had already created a form, and then one of our epidemiologists pointed out that it's going to be very hard to filter out the noise in that data set from people trolling and people just not being well informed. So we landed on the third option, which unfortunately is just to go to the horse's mouth and contact these folks directly. And actually there's an association called NACHO, which is like all 3,000 counties in the US, their public health departments are subscribed to it. So we believe that after our initial push to get the 100 highest risk and show them the value out of our tool, once we have that prototype up on a website, we could easily distribute through NACHO and then eventually hopefully get to a critical mass of 1,000 counties.
I just have the comment that I love this idea. Having a data-driven policy tool for decision making is a much needed tool, and it's a fantastic idea.
Thank you.
Awesome. Thank you so much, judges.
Thank you all.
And we're going to continue to our next team. Oh, so we have dynamic team who's going to be presenting, and I know Jack, you guys were presenting as well, but the slides were not captured, I believe. So could you please share screen, and we're going to time you like this, and let's do these last two teams, and then we need to wrap it up.
Should we start with Dynamic City?
Yeah. And I'm gonna make you, Andrea, a host so that you can share your screen.
Okay.
The co-host. Andrea, bye now. There you go.
Are you seeing my screen?
Yep. And I'm gonna start 3 minutes now.
Hello, audience. This is Dynamic City. Meet Mario, his 55-year-old father of 2 daughters, and they live in Berbenal. To feed his family, he makes and sells empanadas in different neighborhoods. Social distancing in Bogota has restricted him from being able to access supplies or reach his regular customers. The downstream effect of COVID-19 in developing nations is having a negative impact on local and global economies. In Colombia, there's a genuine risk of widespread violence reigniting in vulnerable communities struggling with a lack of access to resources and income. In Bogota, current business models for informal street vendors like Mario are heavily reliant on urban mobility. There is little support from local government for basic survival during quarantine. Before the virus, Mario had to physically go and purchase his supplies, prepare them, and then travel to the vending point to sell his goods. In the current situation, doing this will put him and his community at risk. We propose developing a platform that will help vendors like Mario have a scheduled access to bulk supplies closer to their communities in order to prepare and deliver their goods like empanadas in a hygienic way. This platform also connects Mario to his clients via a marketplace capability, leveraging on Rappi's existing customer base. Our research in the community indicates that most vendors have access to smartphones. This solution removes the need for vendors to travel, therefore exponentially reducing the risk of COVID-19 infection while still supporting an informal economy. We have already reached out to local community leaders and vendors in vulnerable communities, and we have contacted an advisor to the president to prototype the project. The solution will integrate with metadata on disease and economic clusters in order to reduce distances traveled, dynamically optimizing routes, and ultimately reducing the risk of spreading virus, drawing from urban design best practices. The benefits are much greater than the costs. Potential benefits include socioeconomic resilience for vendors, reduced mortality rates for vulnerable populations, savings in cost disease, as well as intellectual property, data, and significant reduced carbon footprint. We propose a phased project. starting with the MVP, which identifies vendors in one community, deploys the solution for them, and returns their economic autonomy. The second phase will integrate vendor support and generate dynamic routing in response to disease changes. Finally, we aspire to be able to use this as a predictive analysis tool to keep vendors and communities safe. For us to be able to help vendors like Mario thrive, we would need support and mentorship, IT resources, and around $500,000 in development costs. This is our dream team. Thank you so much for all the organizers and mentors.
You got it. Thank you, Andrea and team. Let's do 2 minutes. Awesome presentation, by the way. 2 minutes for Q&A and feedback.
Great, thank you. That was sounds like a great idea. My question is, how do you reach the, in whatever pilot community you started, how do you get started with and reach the vendors that you need or that need your services?
Yeah, this is a great question. We already have contacted some local communities. We actually had a focus group with a group of them yesterday. And the idea would be to start a first prototype with this community. And then reach out to more communities through marketing strategies, word to word, social media, etc. Did I answer your question?
Yeah, that was great. Thank you.
Did I hear you right that you're already working with some state and local governments in your area, or is that how you would also probably disseminate the awareness of your platform?
Yes, that could also be a strategy. So we contacted this weekend during the marathon an advisor to the president about this project, and we plan on presenting the project to them this week after we already compiled this presentation to continue the project with them.
Well, that's awesome, team. You guys we are running out of time for Q&A, but thank you so much. This is a very promising idea, and I really hope you guys work on it continue to work on it after the hackathon. See you guys. We'll talk later. Now we're gonna, if you could stop sharing screen, and I'm gonna allow Isabel for the last team. There you go, Isabel, you sharing screen, great. You can unmute, and we're gonna do 3 minutes of presentation followed by 2 minutes of Q&A.
Hi everyone, welcome to Jack, just another cute kid. In an effort to address the effects of social isolation, our team decided to help kids with autism. We believe that community crisis doesn't mean these kids need to be alone. And it is our mission to provide an online support platform for kids with autism and their families during COVID-19 and beyond. This is Cody, an 8-year-old boy with autism who likes going to the park after school. Today though, he can't go to the park because he's stuck at home. He's nervous about this virus everyone keeps talking about, and he misses his friends. Losing his normal schedule is making him feel anxious and become inflexible. Without support from his therapists and social groups, what can Cody and his parents do to adapt to life at home? To help kids like Cody, we're developing an app, Jack. When Cody feels anxious or lonely, he can open the app and board a virtual school bus. This bus represents a safe space where kids can interact under the supervision of their helpful bus driver. Looking out the window, Cody can complete a series of social tasks as he sees peers, teachers, and strangers on his way to school. After Cody adjusts to how the app works, the bus will take an unusual turn, and he will learn how to adapt to the sudden and strange bumpy road that mimics COVID-19. Not to fret though, Cody is not alone. When he hops on the app, he gets to choose an avatar to accompany him on his journey. Maybe Cody is feeling anxious and needs Luna the dragon to remind him that it's always okay to take some time for ourselves. And if Cody's mood changes, he can switch to another avatar. Let's say Cody's parents are a little worried that he has been choosing a calm and quiet buddy for a few days now. He's not his usual energetic self. Jack provides an outlet for family support, where virtual bots provide parents with helpful resources. Here, parents can learn about the effects of COVID-19 and explore the advice of others with similar experiences. As a team, we really want to help kids like Cody. In order to do this, our agile technology team needs to rapidly prototype Jack. Using global partners and relying on a community of stakeholders in ASD, we can reach MVP in 46 weeks. Dynamic market adoption will allow us to adapt quickly to the ever-changing circumstances around COVID-19. Jack's team of international UI, software, and ASD experts is prepared to take on this challenge. We thank you and look forward to our next steps to bring Jack to kids, parents, and the healthcare community.
Thank you so much, Sobel. Great presentation and great progress since the initial pitch on Friday. We're gonna now open it up to 2 minutes of Q&A.
Great.
Also, great presentation and also a great product, I think, to start with. One question, you did mention all the amount of money that's needed, but who are you gonna get to pay for the development and the launching of this product?
Alfred, if you want to take this one.
We already have quite a few resources. I know the company I work for, ehave.com, is looking for applications like this, and we have a suite of investors, and also I know Bill and Melinda Gates, their foundations like that, and also a lot of resources out there are giving money in this area. So we already have that kind of profile set up.
So I don't have a lot of knowledge in the space of autism apps, but are there any existing apps or people you could be working with who already have an established footprint, and you could perhaps add these kind of capabilities into their application?
Mary?
I had it mute there. Sorry. Yeah, that's a really good question. So we had been kind of getting some really great advice from mentors such as Magda, who is working with MIT Media Lab at the moment. She'd been kind of offering us some very good advice there in terms of support. And she's also reached out in terms of she'd love to see where we continue with this afterwards. And we'd also been looking at other existing platforms such as Mightier, which have a partnership with Boston Medical. They use really interesting things like biofeedback, which is something we'd love to integrate, whether that's with an existing platform in terms of monitoring a child's symptoms in terms of triggers, whether they're more anxious or whether they're having a particularly bad day. So there's definitely room for that we're very keen to explore. Yeah, I think as well as that.
Yep.
Yeah.
Thank you, team. That's time. And again, you guys did an amazing presentation. You can unshare screen now, Isabel. And we will now adjourn these final presentations. I want to say a couple of things. First, I want to congratulate everyone in Track E for working so hard over the last 48 hours, or actually under 48 hours, because we officially kicked off this track at around 8 p.m. Eastern. And taking your ideas to something tangible that doesn't only show progress over a very short period of time, but also shows promise in the future and having an impact on the COVID-19 crisis. We will now, over the course of between now and the next session, talk a bit about what the next steps are for you as a team, what resources we have post-hackathon, so that you take this idea and actually put it into practice. Hopefully, the hope here, the goal here, not hope really, is for these ideas to be put into practice, for them being something, not just a weekend experiment or project. So we really encourage you to do that, and we want to equip you to do that. So you're gonna see it now. We sadly are running late, so you're gonna miss part of that. We're gonna offer the recording as well as documentation and the resources available for you to see via the participant guide, which you're gonna continue to have access to. Now at 4 o'clock, we're gonna be showcasing the winners per track. We're gonna have 4 winners per track, and essentially what this is gonna highlight are teams that we believe are best positioned or really well positioned to have an impact. But even if you're not a winner, you should make use of the resources that this MIT COVID-19 Challenge initiative has collated together. We, by forces of the situation, have been able to put together all these amazing partners and mentors that all want to help. So even if you're not one of the winners, make use of the resources that we're going to make available. Now, with that, I'm going to close out today's meeting, and I'll ask the judges to meet me in our Slack channel so we can deliberate.